A very good evening. I'm Aditi Lama with the Wednesday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New Jersey. Welcome to the show. Let's begin the episode taking a look at the coronavirus pandemic updates and measures. The world is at more than 283 million COVID-19 cases and more than 5 million deaths. India has now approved Merck's COVID-19 antiviral pill and 2 more vaccines for emergency use to combat the spread of Omicron in the world's second most populous country. Here in the United States, we are at 53 million COVID-19 cases and at least 820,000 deaths. Cases are rising across the nation and we're losing about 2,000 people per day. 2,000. Let's take a moment and reflect on that. Meanwhile, a CDC forecast has predicted that we would see more than 44,000 deaths over the next 4 weeks. So we should take extra care of ourselves this holiday season, especially with the spread of Omicron. So what should you be doing and how important is the third booster dose? We have tonight answers to all these questions. So let's now take a look at the headlines coming in. US COVID-19 cases hit new high, hospitalizations creep up, Dr. Sandeep Jain, New York. World Health Organization warns tsunami of Delta and Omicron infections across the globe, Dr. Daniel Verga, Hackensack Meridian Health. CDC cuts isolation time for asymptomatic to 5 days, Dr. Tushar Patel, New Jersey. Time for a short break on Vision of Asia South Asian News segment. Don't go anywhere, we'll be right back. On coronavirus updates and measures. The average number of daily confirmed coronavirus cases in the country hit a record high over the past 7 days as US officials weighed the impact of more transmissible Omicron variant. These kinds of daily records were broken this week in at least 7 European nations as well. This surge comes as Americans traveled over the holidays. Hundreds of flights have been canceled since then across the country each day since Christmas, as airline staff has tested positive for the coronavirus. Also, experts still don't have enough information on this new Omicron variant. More than 76,000 people are currently hospitalized in the nation. On this and much more, we spoke with Dr. Sandeep Jain. Here is Dr. Jain. You know, you are associated with many clinics across New York City and New York State. And there's a lot of influx of patients that we're hearing about that we're seeing in the hospitals and clinics across the nation. More and more people are getting tested positive. What are you observing right now, and what do you have to say about this rise in case numbers? Are you actually seeing that?
Yes, we are actually seeing the same numbers as being reported by the state. I think in our offices, probably the number is close to 20-25% in some offices. I'm not surprised. If you remember, the Delta virus was 4 times as infectious as the first virus, and this one is 10 times more infectious. There's just no way, if you breathe air, there's just no way not to get it. Face masks, the ones that are N95s, they would work, but the cloth don't, and it's a highly, highly infectious agent. So I'm of the personal opinion that we're all going to get it.
Oh, wow. That's scary a little bit.
The disease is mild. So, New York State, majority of us are triple vaccinated.
Right.
And that's why a lot of people will be saying, oh, I got the vaccine and I still got the disease. Yes, but that's why you're safe, you're protected.
Right. That's so true. And the World Health Organization has actually been warning a lot of countries across the world that a tsunami of infections will arrive with this Delta and Omicron variant mixed together in the next coming months. Are they speaking the truth, you think?
Yes, I believe the numbers are going to be far more than the previous numbers. There's no doubt. However, the hospitalization rate will be very low. It's just that no hospital system is designed to take a certain percentage of the population as an inpatient. We just don't have those many beds. And the biggest worry for me personally is the healthcare workers that were at the front line, they're falling sick.
Yeah.
And a lot of them have gotten it and they're out of the workforce. Many have chosen not to come back in. So, I think it's for health systems worldwide, this is going to be a bigger challenge in some respects.
Right. And how worried do you think all of us should be right now, especially the ones that are living in the Northeast, about Omicron and the spread that we keep on hearing about?
Yeah, if you've gotten your booster dose, you don't have to worry much. That's my
Okay.
opinion. And it's being borne out by the data as well. Now, if you've had only two shots and you had the Pfizer, for example, I believe your percentage protection is around 50%. If you have three shots, whether it's Pfizer or Moderna,
Right.
your protection is around 70%.
Right.
And even if you get it, it'll be a mild infection. So I'm pretty comfortable we'll ride this out.
Yeah, another big news, doctor, that has come from the CDC is they have changed guidelines for people that are recovering from COVID-19 from 10 days to 5 days if they have mild symptoms. How are you feeling about this, and do you think it's a bit too early for them to do so?
Yeah, I don't think that this is as much science based as much as it is based on practicality. Not that many of us have enough trust now in either the CDC or the FDA or the government. I think the issue here is the bigger issue is it's a mild infection. We can't have so many people come out of the workforce. So everybody staying home doesn't make sense. Who's going to take care of people in nursing homes, for example, or in hospitals? So I believe there's an economic decision here.
Right. Like going forward here, I would like to now ask you about the travel situation that we are seeing across the nation. We're seeing high times travel that we have seen. It's the highest since the pandemic. Dr. Fauci, our nation's top health expert, has said that that the government should consider a vaccine mandate for domestic travel. There is a vaccine mandate for international travel already placed in, but there's none of that for the domestic travel right now. Do you think that could happen? And if so, would that be a game changer?
So personally, I'm of the opinion that the government should have minimum powers, and they should mandate the bare minimum. I think when it comes to people's personal choices, it's best left to them. Do I believe that if you have three vaccines and you fly, you won't get the Omicron? That's not true. In fact, it is so ineffective. If you take an airplane ride, more likely that the chances are that you'll get it. And yet they didn't mandate it early on. I have no idea why they would mandate vaccinations for boarding domestic flights. I don't think it's going to impact the spread. It's already everywhere. So, from a public health perspective, I'm not really sure what it would do. I do feel bad for the airlines and the travel industry in general. However, we have to be very practical at this point in time.
Yeah.
And I personally am against mandates, and I'm personally against forcing people to do something that they don't want to do. I think we're a free country and we're a democracy, and this makes us very vibrant. So, as long as people have all the information, people are smart enough to make their own call.
But then what do you have to say about, the mandates that we are seeing in schools, which are actually being very helpful, where the staff is, vaccinated, which is good because some of the students cannot be.
Yeah, so the Omicron variant is still going to infect people with the boosters shots as well. So it's not like a foolproof, it's not a foolproof situation where you've gotten three shots and you can say, I'm not going to get Omicron.
Right. Continuing this, doctor, a lot of schools are going to go in person starting next week, but some of the universities are going online starting next week as well. What do you think is a smarter decision?
I think people go to schools and colleges for the social experience. We humans tend to learn from each other as well as from our teachers. I think you're taking away the experience if you don't have it in person. At the same time, I believe people should be flexible. And if some of the class wants to be at home, that's fine too, because people have medical conditions or have family members who are dealing with cancers and they don't want to be infected. So I guess each school will find its own perfect method to do this. Again, it should be left up to the schools and up to the students.
Yeah.
If I was a student and I went to a university, of course, I would want to be in person myself.
More on COVID-19 updates and measures. The CDC has released new guidance this week, shortening the isolation period for people with confirmed infections to 5 days from 10, so long as they are asymptomatic. The move has been partly designed to ease staff shortages in hospitals, airlines, and other vital services. Some infectious disease experts, however, have faulted the policy for not distinguishing between vaccinated and unvaccinated people who recover from the virus at different rates. This policy also does not require any testing to confirm a person is no longer infectious before they go back to work or socialize. States New York and California are showing highest daily infections number. On this and much more, we spoke with ITV Go's senior health expert, Dr. Tushar Patel. Here is Dr. Patel. Let's now talk about the big news, doctor, that we are hearing this week, the CDC guidelines that have changed. The guidelines from going from 10 days to 5 days if you get COVID-19 and have mild symptoms. How are you feeling about that? And do you think it's too early?
Actually, this is too late. Most transmission occurs day before, 2 days before, and 3 days after the symptoms. So 85 to 90% of this transmission occurs within 5 days. So those individuals who doesn't have symptoms, who are asymptomatic, they can come out of isolation, quarantine after 5 days and wear the mask. I think that is the most practical approach now in the third phase of this pandemic. We don't need to take too drastic of steps to keep people 10 days on quarantine, because that is not practical at all. And I think that will definitely lead to crisis in the workforce, especially in the first responders, the hospital setting, the law enforcement, and the grocery store. So I think the CDC took this step. It's little late, but I think it's a good step right now.
Wow, that's always a good news when to see CDC do the right thing. Let's now talk about something that Dr. Anthony Fauci has stressed, and it has to do with travel. We're seeing a lot of travel this year. It has been the highest in the pandemic that we have seen. It is holiday season. He thinks that we should consider a vaccine mandate for domestic travel. There's already a mandate, I believe, for international traveling. If anybody that wants to enter the country must show proof of vaccination. How important do you think this step could be if you do it on domestic level?
It could be a game changer for the overall response in this pandemic in this country. If we have that vaccination mandate, just like testing, I think definitely that will help reduce the spread. And I think we can ensure that the people who are catching that flight or getting that flight is safer in the air and not transmitting the virus to others.
Yeah, definitely. And also, for anybody that has tested positive, doctor, during this holiday season, what are some steps that they should take according to you?
So one thing, testing has been a biggest challenge in the USA. It was a challenge last year and no difference this year. The government focused on vaccination, distribution, administration, which was good, but also needed to prepare for the worst case scenario, just like we have right now, 250,000 cases every day, need to have planned for millions and millions of testing. So the good news is by mid of January, we'll have billions of maybe 2 billion tests available in the USA. However, right now, the testing situation is so worse. People are waiting in the line for 2 hours.
Yeah.
So my advice, practical advice to all individuals, if you feel sick, stay home, quarantine yourself for 5 days. If you can get the test, that is the best approach. If you can't, just isolate yourself, quarantine yourself 5 days. If you don't have symptoms, you are okay to go out. But I think it's a very tricky situation right now with the testing, and I think hope within next couple of weeks, and I think the number of cases will double after this holiday, after January 1. By mid-January, my guess is we will see probably 500,000 cases every day, up to 1 million cases every single day.
Oh, wow. So how bad would that be after the holiday season?
So by mid-January, we will see a huge surge in cases. The good news is we will have more testing available at a community level, at a big centers and all the pharmacy. And hopefully that will help isolating people, not spreading the disease. So I think we have some good news and we have some bad news coming. So I think hopefully we can balance those by mid-January.
New York City, just our neighbor, has decided that they're going to open the schools next week in person, and they're one of the largest school districts in the world, in the country. How important do you think that step is, and do you think it's okay for them to open at this point?
So after almost 2 years, we know that how to manage the school, how to manage the kids. Schools can be safely open after the New Year's, as we know how to keep the kids safe by good ventilation, masking, and testing. If we take all those steps, there is no reason for the government or the mayors to have the schools closed. I think January 1, January 2nd, when the school year begins, I think we should be able to safely open the school and have the kids safely back to the school with all those measures we have been taking for last year and a half.
Today, the World Health Organization announced that the simultaneous circulation of the Delta and Omicron variants of the coronavirus is creating a tsunami of cases all across the globe. It stated that Delta and Omicron variants are now twin threats, driving up cases to record numbers, leading to spikes in hospitalizations and deaths. The organization has called on countries to share vaccines more equally and said that the emphasis on boosters in richer countries could leave poorer nations short of the jabs. Meanwhile, more than 13,000 National Guard members have been activated in 48 states here to support the COVID-19 response, from vaccinations and testing to clinical care and other tasks. Focus still continues to be on getting more Americans vaccinated with the first and those eligible with the booster. So if you have not yet gotten your vaccine, please protect yourself and get the shot. Please also wear your mask when indoors in public settings. On this and much more, we have now our conversation with Dr. Daniel Varga from the Hackensack Meridian Health in New Jersey. Here is Dr. Varga.
But no, so from the perspective of traveling, I mean, there's really two issues. I mean, if you're talking about airline travel, there's the period of time when you've got a bunch of people who aren't socially distanced in a relatively tight space, right? So that's the first issue. What you would really like, we already have masking mandates in that, but people have to take their masks off to eat or drink or whatever. And we know that the risk of transmission is lower with vaccination. So I always keep looking at this from the perspective of risk, and we understand that risk is a spectrum of, if you think about risk on a spectrum, you go outside is lower risk than inside. Vaccinated and boosted is lower risk than not vaccinated at all. You know, socially distanced is lower risk than not socially distanced. Masked is lower risk than unmasked. And I think as we look at travel, you know, all of those things should come into play. You know, the degree to which you can validate that people are vaccinated, the degree to which people are, you can make sure people are masked. Yeah. You obviously can't socially distance on an airplane unless you really decrease the number of people on the flight so that you can space them out like we did kind of at the beginning of the pandemic. So I just ask people to think about that. It's practical, it's common sense. You know, I'm boosted. If I get on an airplane, I wear my mask just like I'm supposed to. You know, I think those are reasonable expectations for travel.
Yeah, definitely. I myself just traveled internationally, and you know, you all had to wear the mask, and I kept it on the whole time because that is what you do to protect yourself and others around you.
You're smart.
Two more questions left here for you, doctor. I have to ask you, the therapeutics. We are hearing about this antiviral pill. I believe one is by Merck and the other one is by Pfizer, if I'm right. How big of a game changer is this for doctors? And you know, how effective is it when somebody gets infected with COVID-19?
Yes. So particularly the Pfizer drug, which we're all anxiously waiting for, could very well be a big game changer, because what it does is it kills the virus. It's not like monoclonal antibodies that the virus gets in, you become infected with it, and then you take the antibodies and it neutralizes the effect of the virus in your body so that you mitigate the symptoms. This is actually something you take the pill and it kills the virus. And that does two things. It, number one, helps the individual who's infected not develop severe symptoms and get better faster, but it also decreases the viral load the individual carries, so it decreases the transmission. Now, the unfortunate thing for that is that it's going to be in relatively scarce supply for a while, and we'd ideally would have liked to have had it yesterday. The other thing that's a little challenging about the Pfizer drug too is that it seems to have some drug-drug interactions that you need to be careful of. And since a lot of the folks that you'd want to prioritize this sort of intervention for are folks with chronic medical illnesses, and I'm not 100% sure of all of the medications that folks have referenced creating interactions with this antiviral. But you got to be careful about that. And so how effective it'll be will really depend upon how many people can actually safely take it and how much of it we get how soon.
Yeah, definitely some good news that we are hearing, though, and it's always nice to get some good news during this pandemic. Doctor, my last question to you, I'd like to know your prediction for the next month. We're going into a new year. It's going to be January next week. What is your prediction for the month? What do you think is going to happen with cases and deaths? And what should we all watch out for?
So I think that in the short term, so let's say through the first 2 to 3 weeks of January, I think we're going to continue to see this rise in cases. We're preparing to really continue to have a rapid rise in cases in New Jersey and a rapid rise in hospitalizations in New Jersey. Just simply, even though the hospitalization rate is lower with Omicron, there's just so many more cases. So you're still going to have strain on the hospital resources. I think that the challenge for us in the near term is to not have the healthcare system inundated. We saw what happened to healthcare systems back in March, April of 2020, and the implications that had for the delivery of care other than COVID care. People delayed care that was critical. We had people dying at home instead of coming to the ED, and a whole host of issues. So we really need to make sure that the healthcare system is adequately staffed and has adequate capacity to be able to take care of everyone to the degree we can. But I think we're going to see a continued rise probably for the next 2 to 3 weeks. And if the experience in Europe and South Africa is any indication, it looks like as fast as this surge tends to go up, it tends to come down equally fast. And so we'll be hopeful that the U.S. trend, and we are, a relatively vaccinated country, not nearly as well vaccinated as we should be, or as some other countries are, but we'll hope to see that rapid rise is accompanied by a rapid decline.
With this, we wrap up our show for the night. Please send us your suggestions and get your voices and organizations on our show. You can email us on events@itvgold.com or follow us on our Facebook handle, which is @itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Edison, New Jersey. This is Vision of Asia, and I am Diti Lamba. Take care and be well.